I'm here at Wake Forest University, one of the meccas of tissue regeneration. These are technologies that fascinate me because they could add decades to our life. Let me take a look inside. Hey, how are you?
Good, how are you doing? Nice to see you.
Dr. Atala. What does regenerative medicine mean?
Creating cells, tissues, and organs for patients who may need them. You know, well, right now, of course, we have a limited lifespan because your parts are breaking down. But imagine a time in the future when, once those parts start breaking down, you can just plug a new one right in.
Dr. Atala and his team have grown nearly 24 different types of body parts, including muscle, bone, even this working heart valve.
You can actually see it pump away, and of course you can see the leaflets from above, open and close.
I could use this. I mean, now I could use. That's amazing. It's a real valve.
Yeah, it's a real valve.
When you first got your MD degree, did you ever think you'd be doing this?
No. This is the stuff that we thought was science fiction, right?
I thought it was when I walked in here.
Here's how he does it. First, a mold is built. Then it's seeded with live cells. Then it goes into an incubator, where the cells multiply and grow.
This is actually the room where we cook the organs, if you will. So once they're made, we actually put them into these devices that actually keep these organs alive until we implant them.
In labs across the country, scientists are breaking new ground every day. This doctor is performing a bladder transplant with an organ built from the patient's own cells. It was grown in a lab in about 8 weeks.
Tell me what regenerative medicine could do to our longevity. How long could we live?
I think it's possible to keep extending life, and by putting in those organs that you need, putting in the parts that you need, you'll be able to extend life by several decades.
In our lifetime, over the next 20, 30 years, how much are we going to be able to expand human longevity?
Well, I think if we start combining things like better prevention, better care, doing things better for your body, and this with regenerative medicine, we may even push that up to 120, 130 years sometime.
That's incredible. That's really incredible. And so wonderful what you do, too, because I know that although you're a heart surgeon, that your biggest concern is preventative medicine, getting people to take care of themselves so that they don't have to come and be operated.
You know, it's really cool when you first learn how to do, in my case, heart surgery.
Yeah.
But then when you realize that so often the operation I'm doing is reversing something you did to yourself,
right.
Your soul just starts to seep out of your pores. And that's actually the calling cry for so many physicians and other nurses, you know, healers around the country is to try to get at these problems before they hit us. That stated, sometimes stuff happens.
Right.
Trauma, diseases you couldn't predict, you have to have surgery to take a cancer out, and so you've got to be able to rebuild the body. So take that bladder as an example. So let's say you had bladder cancer and you lost your bladder. Well, what are you going to do? How do you go to the bathroom? Well, until recently, there wasn't a lot. But this is what was in that video. Feel that, Oprah. This is actually the mold that's created to build a new bladder. So I could use this mold, take some of your blood, inject it around this, and over a couple weeks, you'll grow your own bladder. It'll be your cells.
That is incredible.
I know. I didn't realize how far we'd come.
That is incredible.
And it goes on. I mean, this is the same mold.
So you just sort of take some blood and some cells and then put this in the mold, and then that's what they do. They incubate it.
They incubate it. And here's the big breakthrough, is that if you build it, your cells will come. That's basically it.
Yeah.
And so we can actually now recognize that your body's continually making stem cells. It's all about stem cells to a large extent. So even in your blood right now, there's stem cells looking around there and say, you know what? Oprah's left eye is not so healthy today. I'm going to go in there and fix it.
Yeah.
And so we didn't know till recently how to turn that up a little bit. Regenerative medicine is about getting that to work for a bladder outside your body. This is an example. Let's say
This is like science. He was right. It is like, you know, what you used to read about in science fiction or couldn't even imagine happening. This is unbelievable.
Now, I have shown you in the past livers.
Yes.
Feel that. This is a liver that has had all the cells taken out of it.
Uh-huh.
Right? So all this left behind.
This was somebody's liver.
This was an animal liver.
Okay.
And all the cells have been taken out. So you're left with the 2x4s that are the structure of the organ without the actual cells in it.
Okay.
So let's say I took an organ like this out of an animal and I put your cells in it.
Uh-huh.
You could grow your own liver. So when I would look to do a transplant on you, I wouldn't have to take a dead person's. All we need is the mold. The mold can come in many different forms.
Any animal, or would you have to have an animal that was like, you know, a primate or something similar to...
No, it doesn't have to be the same animal. In fact, the heart that is closest to ours is a pig heart, which is what this is.
Yeah.
You can sort of see that up there. It sort of looks like a heart.
Oh, that does, yeah.
And you have a lot of experience with these now.
Yeah, that's a pig heart that with all the cells taken out of it.
Exactly.
Yes. So you would take that pig heart and inject some of your own cells.
Take my blood, spin it down, put the cells into this, baste it in that chamber that we showed in the video, and it will slowly grow your own organ back.
That is incredible. That is, don't y'all think that's incredible? That is Woo! Okay, let me just answer this. So that means if you're going to have a heart transplant, you could have a heart transplanted with your own cells. So you rebuild your own heart.
Exactly. So no medications.
No medication.
This is the part that's really important. We have about 7,000 people waiting for hearts, for example. We only get 2,000 donors. This is an opportunity for us to regenerate.
That's why this is big. Were you not blown away?
Completely. By the way, as much as I follow this stuff, I had no idea how far this field has come.
Wow.
I mean, that huge advance.
Okay.
And now the other thing we learned with these tissues is that you have to actually stress them. Tissue wants to be used. See that inside this tube?
Yeah.
That's an artery. Put your finger right next to that trachea, and you feel that little pulse, that little bounciness right in here? Okay, that's the carotid artery. That's this artery. But it's made from this mold. Let me have your hand. And just hold that up there. And you see that?
Looks like a straw.
It looks like a straw.
Yeah.
But if you take that straw, again, it's just a mold, and you plant cells on it, and then you put it in a chamber and push on it, like your heart would be pushing on a blood vessel, you can regrow a blood vessel. Which means that all of these different synthetic products you try to put inside your body, we don't have to do that anymore. We could actually make blood vessels to replace your busted blood vessels.
And how long would it take to do that, though?
This takes weeks, not years or months or anything. It's pretty short term, which is why it's becoming into something that's viable for clinical practice.
Now, when we come back, we're going to meet a man who actually had something regenerated. We'll talk to him when we come back. Really amazing. So, Dr. Oz has someone he wants us to meet, right?
Lee, come on up.
Hi, Lee.
Hi, how are you? Come over here.
Nice to see you. Hi.
Now, Lee, show Miss Winfrey your finger. I mean, she wants you to look at the fingers, not giving you the finger.
Yeah, I'm not okay.
Does that
This finger?
That one.
Okay, good.
Does that look okay to you?
Yeah.
All right, so Lee's got a hobby. He builds model airplanes and plays with them.
Does this look okay to you? It's a finger. Yeah.
All right, let me show you a picture of what Lee's finger looked like after he was done playing with the airplanes one day. And the person who solved this is an expert in tissue re-engineering, happens to be Lee's brother, Alan, who used extracellular matrix material from pig bladders. And here, hold that if you don't mind. And just look at that. See that powder?
Yeah.
It's like pixie dust. So what you do with that, Lee?
I applied that to the wound and just put a Band-Aid over it. Did it for 10 days or 5 times, and in 4 weeks I regrew the finger.
Now, that just blows my mind. You can regrow. Imagine a GI.
So you didn't, like, reattach the finger?
We lost a piece of the finger. We couldn't find it.
Couldn't find it.
Right.
It's a bad problem.
They were going to do a skin graft. I called my brother, Dr. Alan Spivak, who developed this material. He sent it to me, and I treated myself.
So the folks at the University of Pittsburgh are looking at this right now as a way of maybe creating that kind of scaffolding, that mold within the body to rebuild injured heart, kidneys, liver, but especially fingers. I mean, look at this. It was cut down to the base.
Yeah.
And this nail, he was telling me before the show, grows faster than the other nails.
Wow.
This is 70 years old. This is only 3.5 years old.
Really? Wow. I wonder if you could use this, like, for bald guys and just grow hair.
Yes, you can.
It's so funny. That was the exact first question.
What?
That was asked.
Because I'm thinking that's what most men want. They want to grow their hair. And so
there it is.
I haven't done that yet.
You can grow a finger by rubbing it on your finger. I'm thinking rub it on your head and grow some hair.
Yep.
That is, okay. And what's the company's going to own it? Because I'd like to invest in that. I think...
My brother's company is ASA.
That's right.
Yeah, I think this is going to help the stimulus package, really. Really. Stimulating regrowth, yeah.
What this basically does, it keeps the wound from healing normally. and the body sends cells to it and grows itself.
That's pretty incredible. Thank you.
Thank you.
Thank you.